Hello, my name's Dean and welcome to this short video introducing you to counselling. Now, many people are unsure about whether counselling is right for them, or they're just unsure about the process in general. So hopefully with the information I'm about to provide, it'll give you a better understanding about whether it's right for you. So what is counselling? Well, it provides you with a safe space and a trained therapist, and you can talk about any issues that you may be experiencing. These issues could vary from depression, low mood and anxiety, through to past traumatic events or abuse that you experienced. Whatever the reason for you to attend counselling, your counsellor will help you explore your thoughts, your feelings and your behaviours, which will help you develop a greater understanding of yourself, others and your situation. And this will always be done freely and in strict confidence. However, therapists are governed by professional bodies, and these bodies have strict ethical guidelines, one of which that states it is your right that everything you choose to discuss will always be kept confidential, except in extreme circumstances. Now, these circumstances are situations of terrorism, money laundering, or drug trafficking. There are different types of counselling. You may have heard of some of them. The psychodynamic approach, which was made famous by Sigmund Freud, believes that we are driven by the subconscious parts of our personality. It often uses dreams and metaphors of understanding why we are the way we are. Behavioural therapy focuses on behaviour patterns. Therapists often adopt this approach when a client has unwanted or maladaptive coping strategies. This type of therapy is often used to deal with behavioural issues or mental health that involves unwanted behaviours, such as addiction or a phobia. Counsellors that follow a behavioural approach believe that the unwanted behaviours have been learned and can therefore be unlearned by engaging in therapy. The cognitive and behavioural approaches are often combined to form one theory, and this has proven to be very successful for issues such as depression, anxiety or substance misuse. And then finally there is the humanistic approach. Humanistic counselling places the client as the most important aspect of all that happens. Humanistic therapists are most interested in the present and aim to help clients achieve their full potential. This is done by emphasising the belief that all humans are inherently good, enabling them to believe in their self-growth and self-actualisation. Integrative counselling draws on techniques from different types of therapy to tailor an approach specifically for you. Counselling can take many different forms depending on your needs and what type of therapy may be suitable. So therefore, many counsellors will adopt an integrative approach to their sessions. These counsellors believe that not one approach in therapy fits all clients, so they factor in the individual and their circumstances, and they utilise elements of all approaches to help you explore your feelings and understand your difficulties. Most therapy will take place during a planned session that will last for 50 minutes. How many sessions you have will depend on the individual, but it is recommended that your sessions are regular, with once a week being suggested as ideal. Everyone's circumstances are different, so it's important to agree the details between yourself and the therapist. This is done by contracting and will take place during your first session. The reasoning behind it is to make sure the relationship between client and therapist is professional, safe and clearly defined. Now, there aren't any actual rules around a written contract for counselling, but in general it will contain some or all of the following: contact details, boundaries around contact outside of sessions, what to do if you need to miss a session, confidentiality, and ending therapy early. But before you go to your first session, it's important to ask yourself, what are my expectations from this process? It's really important to think about what you would like to achieve. Here's a few things to get you thinking. 1. A counsellor's role is not to fix your issues for you. If you think this is the case, you will not be happy and probably disappointed after your first session. A good therapist will help you engage with your strengths and resilience, enabling you to bring out the best of you. A counsellor that does things for you or suggests things is creating an unhealthy relationship whereby you become dependent on them. Expect that your therapist is not there to save you, rather to support and guide you. 2. Have you considered the possibility of certain issues being brought to the fore of your mind? These issues could be painful memories that you have suppressed, and with them resurfacing could leave you more vulnerable in the short term. 3. Are you truly willing to engage with the process? Are you willing to be patient and persistent in the method? It may take longer than anticipated for a therapist to uncover your strengths or true issues. Trust the process. Therapy is like most things in life. You get out of it what you put in. By attending your sessions, be willing to engage with the process and looking deeply into your thoughts and emotions, you will be able to positively transform your thoughts and behaviours into a safe, nurturing and neutral space. And remember that a counsellor will always remain impartial. They will never give you their own opinions or advice. Through talking together, a counsellor will enable you to find a solution, and that could be through making changes to your lifestyle or enabling you to develop coping mechanisms for the issues you may be experiencing, but it will always be done together. Well, that's it from me now, guys. Hopefully this short video has given you a better insight to what you can expect from counselling services, and I hope to see you soon.